While many Americans can't wait to get their COVID-19 vaccine, there are also people like Kim Corbett and her daughter, Morgan Thomas, a psychologist. They say their reasons against the vaccine boil down to how the government treated Black Americans in the past.
Historically, the proof is in the pudding. We aren't a priority, and I don't think we ever have been a priority for the government in terms of health care.
Dr. Jermaine Scott, an African-American studies professor at FAU, says one of the most notable examples is the infamous Tuskegee study, which began in 1932. Black men were deliberately denied treatment for syphilis when there was a known treatment for it.
They used the men as for experimental purposes to study this progression.
An advisory panel later deemed the experiment as ethically unjustified and advised the study come to an end. And although victims and their families reached a $10 million settlement, experts say they understand how history is fueling fear of a COVID-19 vaccination.
African Americans have every right to be suspicious of the medical system of the United States, and this really goes back to the institution of slavery.
Vascular cardiologist Dr. Bernard Ashby also understands some of that suspicion and says the Black community deserves to have some skepticism, but he's still in support of a COVID-19 vaccine.
Black folks are 5 times more likely to be hospitalized once infected with the coronavirus. So we are, by every measure, highly vulnerable to this particular virus, and it's very important that we focus on preventative strategies, and vaccine administration is one of those measures.
Experts still believe the current state of race relations in our country deters people of color from trusting the vaccine.
I think because of the injustices we experience, not only in the medical, but the legal and other fields of life, there's just overall a lack of trust and understanding when it comes to what that vaccine could do.
And it's not just African Americans who are skeptical of a coronavirus vaccine.
There's no reason for the Latino community to really trust a system that was never meant to help them in the first place. So it goes back to that lack of access to healthcare.
And since COVID-19 disproportionately impacts Latinos and Blacks, Mariana Blanco, who helps run the Guatemalan Maya Center, agrees with experts, saying it's people of color who need the vaccine the most.
Our big thing is vaccines. We're really trying to push the vaccines with our community.
The Guatemalan Maya Center is also urging the governor to make the vaccine available to migrant farm workers, calling them essential. So far, the governor has not publicly responded to that request.